T-levels are a new 2-year qualification for 16 to 19-year-olds with an in-depth 45-day industry placement at the heart of each course. Designed with employers, each T-level placement helps employers find solutions for entry-level skills shortages whilst developing future talent for the business. This series of conversations will explore T-levels and industry placements with employer guests from across the public sector. Good day, my name's Bruce and I'm your host for this conversation on T-levels. I'm very happy to be joined today by Ray Olive. Ray, how are you doing?
Yeah, very well, Bruce, thank you.
Thank you for being here for this conversation. Ray, people don't know you, it's fair to say, some people may. I was wondering if you could open with a bit of information about what it is that you do and a bit of your background, how you've come to kind of circle this area of T-levels.
Yeah, of course, Bruce. I'm Ray Olive. Currently, I'm the Assistant Director of People and Organisational Development for the University Hospitals of Morcambe Bay NHS Foundation Trust. Previous to that, I was an engineer within the Army. So I worked for the Ministry of Defence. I got involved with T-levels because what can only happen in the military is I was voluntold by my regimental colonel to apply to be on the panel. Lo and behold, I did apply. It was something that I really did believe in. And they asked me to be the chairman, which was a fantastic offer. But part of that, and being serious, I felt it was only right that I gave back to T-levels and gave back to society after everything that the military had done for me. So being involved in the development of a technical qualification in engineering, having gathered 25 years worth of experience myself, I thought was only the right thing to do, Bruce.
Well, thank you for that. Quite a detailed answer, I guess. And I love the idea of just being voluntold. Yes, you're doing this and have a good time. And you mentioned something quite interesting there, Ray, about this idea of giving back and T-levels being potentially a route to that. Obviously, you were kind of first told through that voluntold experience, but what were your first thoughts when you first encountered T-levels? Obviously, they're quite new. Not many people knew about them at the time, certainly then. What were your initial views on what they were and how they were different from other qualifications?
So it's really interesting you asked that, Bruce. So when I was first approached about them, I didn't really understand what T-levels were. So I had to do my own research, and as an engineer, that's something we love doing. So I actually sat there and read the entire Sainsbury's report. And the thing that really got me about them was what they were being designed to do, and the fact that they gave people a real option to simplify technical education going forwards. And to give people skills in an area that will really impact upon this country. And I think that for me, that was what was really unique about them, is that they were focused. Taking engineering and manufacturing, for example, the T-level that I was the chairman of one of those pathways, that's an area for the country that has got a significant skills gap. And I really did see that T-levels could address that skills gap that's currently expanding in the country right now.
In terms of what benefits you've seen specifically, obviously you have a history in two quite different employers, quite large employers. What benefits did you see in T-levels that supported those organisational needs that you desperately needed?
So, my organisational needs, from the military to the NHS are not too dissimilar. We require young, talented, skilled individuals to come and make a difference in our sector. And actually, both sectors are not that different. We employ a vast array of different people. The NHS employ engineers, as the Army do. The Army employ nurses. Well, so do I in the NHS now. So, all of that is there, and there's so many areas of T-levels and the skills that they will get in those different pathways that is really attractive to us. They have this really broad knowledge that's been designed, but they have skills that are so unique, and they'll bring that diversity of thought to my business, in effect, something that is truly priceless. So, that coupled with knowledge and skills that are based on industry requirements, it is really, really important. So, taking these people, they will add such benefit to my business and any other business out there.
Obviously, that's then quite exciting. What are your organisation's plans for industry placements? How are you going to use them going forward?
So industry placements for me and for my organisation are really key. We have a number of different pathways which we're looking already with our local partners, our local colleges and higher education and further education establishments, so that we can develop the number of placements that we take. My organisation currently is split across 1,000 square miles. But we're already looking at taking people from a digital background to help us enhance our digital capabilities. There's so many opportunities at the moment with enabling electronic booking for patients and having someone who's got a skill set and a knowledge in that to help design, applications to make the patient experience so much easier. It goes without saying that the adult nursing, support to adult nursing, that's crucial. I've got nearly 2,000 nurses employed in my trust. So having those people in, learning from those people that have developed so many more skills during COVID will absolutely round those students off, and it'll give them that real eye-opening opportunity as to whether nursing is something they want to do for themselves. And then obviously the pathway that's very dear to my heart, engineering. I've got an entire estates and facilities team that have to maintain the hospital.
Jumping back to something you said previously, your trust covers 1,000 square miles, big old space. You're obviously working with a lot of providers there, a lot of local providers that you have to interface with. Is there any examples of good practice that you can give us in terms of building strong, positive relationships with those people?
Yeah, so right now we are very busy working with the three main colleges in our area. So we cover, a huge area which jumps across 2 different counties. It's the joy of living up here in the Lakes. It is a huge area. But we've set up a working group, so we're already looking at how we can work together so that I can provide placements and standardized placements with all of them. So it's that real quality engagement with the provider is enabling that to turn into a real quality placement. And I think that's probably the one big key, is that early engagement from the employer with the FE establishment is crucial. When I was the chairman of the panel, one of the key things that I learned was from one of the other NHS trusts that was doing the industry placement trials. And NHS Oxford Trust and Activate Colleges in Oxford had a really, really good, simple arrangement. And every single placement was treated as an employee on the books of the NHS. They had their ID card, they signed a contract, they were inducted into the trust. And I'm taking all of that knowledge that I learned and feeding that into my partnership that I've got up here, so that we can learn from all of that. And I think that the biggest key from that was treat the industry placement as an employee. And if you do that, you can't go far wrong.
In terms of your interface and certainly the trust interface with T-levels, what are the marks of quality and success that you're looking for industry placements within your sector?
So for me, a quality placement is one where the student that comes into my establishment goes out of it a different person. They've learnt the skills, they've been able to apply their knowledge into a practical environment, and they walk out having developed some of those really key fundamental work knowledge and experience that you can only get from employment. So whatever T-level placement we take, whether that be digital, nursing, a laboratory assistant, an engineer, any of those that come into us, the real marks of success is whether that person has developed those skills in an environment where they've felt included, and wanted, and that they've learnt. And we really would like to say that, we'll look after them. We are one of the largest employers in our area, so we have that social responsibility to ensure that, the next generation get that qualification, they get that skill set, they get that knowledge. And then the real crux of this is, if T-levels can close that skills gap that we currently have in this country within industry, then not only is the T-level succeeded, but so is the industry placement.
What do you think the effects will be on the sector long term? And I guess, if as an extra question to this, if you're perhaps a part of an NHS trust, or you're in the healthcare sector and you're listening to this and you're thinking about T-levels, what would you say to those people about getting them involved in this?
Just do it. Absolutely, Bruce. Just do it. Get involved now. At the moment in this country, we have a real problem with the number of nurses, for example. Just picking on one area. The T-level, there's a pathway there. There's a specialism that enables people to follow that direction. At the moment, we have to rely heavily on international recruitment. T-levels, if they're successful, will fill that gap. They will fill that void. My ultimate aim, dream even, would be that we don't have a vacancy rate within our hospitals for medical staff. And it may be that, someone who does a T-level doesn't go into nursing. They may go on to become a doctor. They may become a radiographer. But the T-level will be that pathway for them to then go off and to discover that. And that's something where the industry placement could help shape, because they may see, because they will be exposed to what the doctors are doing, what the radiographers are doing, even what the engineers are doing. So it can really help guide them. And I think that, that's the real beauty of it.
Yeah, there's almost this idea of letting people align against their passions and their natural skill sets just through being in an environment where they can see so many different things, and that important understanding that there's an understanding that they're learning, that they are there to understand whether they had a passion for these things, and therefore they can chop and change to an extent. The power of youth, I think, is somewhat understated sometimes, and you've elucidated it really nicely there in terms of a future where, for example, there are nursing numbers that are filled so easily. Kind of a wider question then about young people. Why is it so important to attract young talent into your sector?
Bruce, I think that's really quite clear. The military recognised this when I was there, and we set up placements to ensure that we could deliver that effect. And part of it is young people think differently. They give you a completely different perspective on how to do something. That they're very agile in mind, so they will see solutions to problems that you don't see, and they will be able to bring that unique perspective to the business. And I think that that's one of the really big advantages about recruiting a younger generation. One of the issues that affects the NHS is the number of people that are approaching retirement, and the lack of people coming in at that younger generation. And that's across all, trades of employment, or all strands of employment within the sector. So getting the younger generation in allows for, those people that are going to be retiring. COVID has taken its toll on us as a sector, and I think that cannot be underestimated. So, getting that young blood into and reinvigorating, the NHS is really important. But as I say, the military saw that and saw the huge potentials of taking young talent and moulding it. And I think that's the beauty of taking someone on a placement, is if you've got that person for 3 months, whether it be on a day release calls or a block period, you can really get that person thinking about your values and your beliefs as an organisation. So you can mould that individual to fit with your culture. And I think that's really important, because then you've got the benefits to your business that individual's already, molded into your values and buys into your beliefs in your business. But you get the benefits of that individual's enthusiasm, their mental agility, and their diverse train of thought that they will bring with them. So, I think that's really important that we engage this next generation of, skilled employees, and help them. But more importantly, they'll help your business.
Yeah. So classic, there's no replacement for youth. And you can try and cling on to a workforce for as long as you can, but they're only going to get older. And so there's that constant need for injection of young, bright minds, fundamentally. Ray, sadly, our time is drawing to a close. I have one final question to you. It's a nice, easy one. Often say that people remember one thing from a conversation. So what would be your call to action if you were to talk to other employers, grab them, and you had one thing that you wanted them to take away? What would you say to them?
I'd implore you to take industry placements. Engage with your local, education provider, and really, really exploit the benefits of industry placements within T-levels.
Perfect. Well, Ray, thank you so much for your time, and thank you all for watching or listening to this, however you've got involved. This conversation is one of several, so please, if it's been of interest, make sure that you get watching the others, get engaging with them. Would obviously love to know your thoughts. For now, though, thank you all so much, and goodbye.